Sickle cell disease is one of the most common serious genetic conditions in the world, which has a life-threatening outcome. Sickle cell disease is a serious lifelong condition, which is an inherited blood disorder. The condition is marked by flawed hemoglobin. This means sickle cell disease interferes with the delivery of oxygen to the tissue. According to Sickle Cell Society, a UK charity organisation, approximately 1 in 79 babies born in the UK carry sickle cell trait. About 15,000 people in the UK have sickle cell disorder, and almost 300 babies are born in the UK with sickle cell each year. In a 2020 report from sicklecell.com, as high as 40% of people in some African countries have sickle cell trait. In countries with poor resources, more than 90% of children with sickle cell disease do not survive to adulthood, and about 1,000 children in Africa are born with sickle cell disease every day, and more than half die before they reach the age of 5. The report also states that 20% of children with sickle cell disease in India die by the age of 2. It is estimated that by 2050, the number of people with sickle cell disease will increase by 30% across the globe. The World Health Organization estimates that Nigeria, Africa's most populous country, has the highest burden of sickle cell disease, as 150,000 babies are born every year with sickle cell disease. Rabi Medunama, a sickle cell advocate and founder of Sickle Cell Foundation, a guest on Wellbeing, a health program on AD4 TV radio, also confirmed that Nigeria has the highest rate of sickle cell disease, while calling for sensitization and awareness outreach to the public, especially the rural communities.
And then Nigeria now, we have the statistics of 1 out of every 4 Nigerian is either a sickle cell carrier or a sickle cell warrior. So it's like 25% of the population are already affected. It's like a time bomb. So it is true. If that is what we have, then, getting the match is always difficult, and people just keep marrying each other. This is where now cultural and religious difference now plays a role that has refused to reduce the number of sickle cell patients in Nigeria. Our cultural and religious beliefs is the number one factor. And then, of course, people in the rural areas, lack of education, lack of awareness, ignorance, and all this has led to this, what Nigeria is facing today.
Are those some of the challenges you face?
Yes, of course. Yes, even the educated ones, I'm kind of disappointed, because when you're doing a counseling session with couples, they use religion to try and get away with it.
And I expect religious leaders to be more responsible.
Exactly. Now we commend the churches. I think they're doing a fantastic job.
Absolutely.
Yes.
You have to get a test.
Yes. HIV, genotype.
Genotype, yes.
People from the north are still dragging their feet.
She also spoke on some of the terrible crises people living with sickle cell face. In the United States of America, sickle cell disease is more common in Americans whose ancestors were from Africa, South and Central America, as well as India. The U.S. Center for Disease Control and Prevention projects that about 100,000 Americans have sickle cell disease, and about 1 in every 13 blacks have sickle cell trait. About 1 in every 365 blacks have sickle cell disease. The report further showed that about 1 in every 16,300 Hispanics had sickle cell disease. Many people with sickle cell disease suffer from severe pain, depression, discrimination, and stigma. These ailments can lead to a host of complications, which include stroke and blocking blood flow to an area of the brain. All major organs of the body are affected by sickle cell disease. The liver, heart, kidney, gallbladder, eyes, Bones and joints can suffer damage from abnormal functions of sickle cells and their inability to flow through the small blood vessels correctly. Other problems associated with this condition include increased infection, leg ulcers, bone damage, early gallstones, kidney damage, loss of body water in the urine, eye damage, multiple organ failure, and many more. Even the World Health Organization and the United Nations recognize sickle cell disease as a global health issue. Till date, the only cure for sickle cell disease is bone marrow or stem cell transplant, which is a procedure that takes healthy cells that forms blood from one person, the donor, and puts them into someone whose bone marrow is not working properly. Bone marrow or stem cell transplant are very risky and can have serious side effects, including death. For the transplant to work, the bone marrow must be a close match. Usually, the best donor is a brother or sister. Bone marrow or stem cell transplants are used only in cases of severe sickle cell disease for children who have minimal organ damage as a result of the disease. But on the brighter side, sickle cell disease is not contagious, so it cannot be transmitted or passed to someone like cold or an infection. People with sickle cell disease have it because they inherited 2 sickle cell genes, one from each of their parents. In some type of sickle cell disease, people can inherit a sickle cell gene from one parent and a different abnormal hemoglobin gene from the other parent. Children become victims of sickle cell disorder because of their parents. Take for instance, a man and woman both have sickle cell trait. Their child has a 25% chance of being born with sickle cell anemia. If only one of the partners have the sickle cell trait, the child cannot be born with sickle cell anemia. But there is a 50% chance that the child will be born with sickle cell trait. If one parent has sickle cell disease and one parent has sickle cell trait, there is a 50% chance that their children will be born with sickle cell disease. To this end, knowing one's hemoglobin genotype before choosing a life partner is very important. But beyond the test, intending couples should be bold enough to quit a relationship if they discover that their genotype is not compatible. This way, we will not have to worry about cure since it has been prevented. Prevention, they say, is better than cure.